Assalamu alaikum warahmatullahi wabarakatuh. Hello and good day everyone. In this video I'll be covering this paper, which is a systematic review based on clinical trials exploring the effect of orthodontic treatment on auto-transplanted teeth. So orthodontic treatment with space closure or associated with dental implants are not always accepted by the patients due to the longer treatment time involved and the economic considerations with the prolonged treatment time. And in such situations, in the presence of the sufficient space or diastema, the tooth auto-transplantation may be a suitable choice. Many previous studies have described the high survival rates of transplanted teeth, but none of them have evaluated the influence and long-term results of auto-transplantation in orthodontic patients. So the focus of the study was to conduct a systematic review on auto-transplantation, considering the impacts on teeth, bone, soft tissues, and aesthetics in orthodontic patients. The focused research question was, is there any scientific evidence of the reduction in survival and success rate scores of tooth auto-transplantation in orthodontic patients who were submitted to the movement of these teeth compared to control groups? For the design of the study, starting with the PICO question, the participants of the study were orthodontic patients with complete or incomplete root developments with a minimum age of 9 years. The intervention were auto-transplantation with the orthodontic movement compared to control group, and the outcome was subdivided to 4 outcomes evaluating the bone, which is the presence of adequate lamina dura, the bone resorption, the height and bone prominence, and the vertical bone loss. The second outcome was the tooth, if there was any root resorption, changes in pulp chamber, the tooth vitality, color change, mobility, or ankylosis. The third outcome was the periodontium, the presence of pocket depth, periodontal space, and gingival recession, and lastly, the aesthetics and patient satisfaction. For the criteria, they included studies which reported the survival rates, success, pulp condition, mobility, presence of ankylosis, and all of the previously mentioned parameters with a minimum of 1 year follow-up. For the exclusions, patients with systematic diseases or syndrome, cleft lip and palate, studies reporting auto-transplantation of teeth with histories of cysts, tumors, trauma, or fistulas were excluded. Studies without information about the follow-up time or root resorption, case reports and series, and animal studies were excluded. After screening the titles and the abstracts of 443 articles, 10 studies were selected. As they met the inclusion criteria, all studies were longitudinal, prospective, or retrospective controlled clinical trials, all in which evaluated the results of auto-transplantation in orthodontic patients. The risk of bias of all studies were evaluated using MINORS, MINORS, based on M methodological, I index for non-randomized, the NOR, studies S. Each study was scored based on specific criteria such as the clarity of the stated aim, the inclusion of the patients, the prospective data collection, the unbiased assessment of the study endpoint, the follow-up period, the loss of follow-up, and other parameters. They were given score 0 if the information was not reported, 1 if it was reported but inappropriately, and 2 if it was reported properly. The articles were then classified based on their methodological quality. If it got a score that's more than 17, it was considered low. Between 10 and 17 was considered medium, and the high risk of bias was considered if it got a score that's less than 10. The results of the survival, the success in endodontic treatment, ankylosis, resorption of each study was described, along with the parameters on pre-operative assessment, operative protocol, and post-operative assessment. Coming to the results, root resorption was reported in 7 of 10 studies with an occurrence of 6 to 64%, with a reported risk factors that could significantly increase resorption were 1. Excessive early orthodontic force, 2. Correction of irritation if there was any, 3. Teeth with multiple roots. Furthermore, 3 studies were reported to have a higher rates of ankylosed teeth, with an occurrence of 18 to 42% in a period of 10 years. The risk factors included trauma to the PDL during the surgical procedure, endodontic treatment that was performed extraorally. There are some worth mentioning limitations of the study, which includes the high degree of heterogeneity in the methodological design and the interventions among the studies, such as selecting the control groups. Although all of them had a minimum number of 30 patients with transplanted teeth without the orthodontic movement, there were 4 studies which used the adjacent non-transplanted teeth as control. The greatest variation occurred was in the splinting method. Some of them used just the suture thread, and some used the arch wires with resin cemented acrylic plates, while others used the brackets and acrylic resins. And they also differed in the splinting duration, without clearly discussing the reference or the best method and time. Another limitation was that they also differed in the radiation imaging technique. The majority of the studies evaluated were conducted before 2004, at the time where the 3D CBCT scans were not routinely performed in the clinic. So for that reason, most studies that were included have used the 2D images to analyze the stage of root development and apex. Some of them depended only on the panoramic image, and others depended only on the periapical images. However, more recent studies that were after 2004 have utilized the CBCT 3D analysis, as we know the necessity of it in treatment planning and accuracy in the outcome assessment. And lastly, although there was a great uniformity among the studies with respect to the surgical technique, there were some missing records, as none of them have clearly reported the angulation, intraosseous position, and the manipulation of the donor tooth, as well as the previous history of orthodontic treatment. Coming to the practice implication, although root resorption and ankylosis of autotransplanted teeth have increased in patients undergoing orthodontic treatment, it was not considered as a limiting factor for treatment. There was an increase in root resorption influenced by orthodontics, but without impacting the general results in outcome on the long run. For the research implications, as I mentioned, the retrospective studies, which had a medium level of bias, indicates the need for better designed projects such as randomized control trials with sample calculations to really obtain clinical answers, as most of the randomized clinical trials that were included in the study, none of them have mentioned the sample calculation. And finally, for a future research implication, planning in 3D with detailed parameters relative to the survival versus clinical success in the long term need to be approached. And thank you so much for listening. Hope you have a nice day. Bye bye.